about to say something that's going to make some of you very uncomfortable. Are you ready? Long-term antibiotic treatment for pandas doesn't just fail, it can make kids sicker. And I know your pediatrician told you antibiotics are the answer. The PANDAS specialist said to keep going. Just one more round. Let's try a different antibiotic. Maybe prophylactic dosing will work. Meanwhile, your child has been on antibiotics for 6 months, a year, 2 years, and they're not getting any better. In fact, they might be getting worse. So this week, I had 2 consultations, 2 different families, same story. First family, 7 rounds of antibiotics. 7! The strep titers won't come down. The ticks are worse than ever. The anxiety is crippling, and the pediatrician just prescribed round 8. Second family, their son has been on antibiotics for 2 years. Not 2 months, 2 years. And every single time they try to stop, even tapering slowly, the rage comes back. The OCD explodes, and it's like watching their child disappear all over again. And here's the question nobody is asking. If antibiotics worked for pandas, why? Why are there thousands of families stuck in this exact same cycle? And I think the answer is probably going to make you angry because it means all the time, all the suffering, all of the antibiotics, and they were treating the wrong problem. PANDAS is triggered by strep, but PANDAS isn't about strep. It's about immune dysfunction, and you can't antibiotic your way out of immune system dysfunction. In fact, antibiotics are making the immune dysfunction worse. If you're watching this video, you are probably trapped in this cycle. You feel hopeless. You feel like you're failing your child. You're counting rounds of antibiotics like you're counting losses in a war you cannot win. And I need you to hear me. This is not your fault. You are not failing, and your child can get better, but not like this, not with more antibiotics. Hello, everybody. My name is Dr. Piper Gibson, PhD, and I am the founder of the Tick Disorder Institute, Regenerating Health. And today we are going to talk about why antibiotics are failing your child. Because once you understand what's really happening in your child's body, everything changes. This is the information that most doctors don't know, and they don't know to tell you. But you need to know it. So let's dive in. But before we dive in to why antibiotics fail, we need to understand something crucial. The difference between PANDAS and PANS. And the distinction is everything when it comes to the treatment and the recommendations around PANS PANDAS. PANDAS stands for Pediatric Autoimmune Neuropsychiatric Disorders Associated with Streptococcal Infections. This is when strep, group A streptococcus, triggers the sudden onset of OCD, tics, anxiety, and other neuropsychiatric symptoms. PANS stands for Pediatric Acute Onset Neuropsychiatric Syndrome. This is the broader umbrella. PANDAS is actually a subset of PANS. And here's what people don't realize. PANS can be triggered by strep, which we know makes it PANDAS, but it can also be triggered by mycoplasma, Lyme disease, viruses, bacteria, mold exposure, environmental toxins, heavy metals, food sensitivities, and basically any trigger that causes immune dysregulation and neuroinflammation. Now here's where the paradox keeps making your child sick. Your child might have both PANS and PANDAS at the same time. They have strep, that's the PANDAS part, but they also have mold exposure, food sensitivities, heavy metals, candida overgrowth, environmental toxins, parasites. Those are all PANDAS triggers. So we're throwing antibiotics at the strep, trying to treat the PANDAS, but the antibiotics can't work because the immune system is completely overwhelmed by all of these PANDAS triggers. The immune system literally cannot clear the strep because it's fighting battles on 5 different fronts. And here's the cruel irony. While we're using antibiotics to kill the strep, those same antibiotics are damaging the gut lining, wiping out good bacteria, creating candida overgrowth, and suppressing immune function. So we're actually adding to the PANDAS burden while trying to treat the PANDAS. This is why your child can be on antibiotics for 2 years and never get better. We are treating one piece of the puzzle while ignoring all of the other pieces. Worse, the treatments are making some of those pieces worse. This is the missing link that nobody is talking about. This is the missing link that nobody is telling you about. So I want to talk about something that's actually going to surprise you. Did you know that group A, Streptococcus, the bacteria behind PANDAS, has been 100% sensitive to penicillin for 80 years? That's right, 0 resistance. And yet, antibiotics fail in about 30% of cases. So if it's not antibiotic resistance, what's going on? And here's what the research shows us. These antibiotics fail to clear up strep infections, and it's not because the bacteria are resistant. It's because of something called treatment failure mechanisms, and we are going to break that down. The first mechanism is bacterial hiding places. Some strep bacteria have a special protein. It's called protein F1 that lets them invade and hide inside your cells. Think of it like bacteria going into a bunker. The antibiotics can't reach them there, and they are in cellular hiding. But here's the kicker. Beta-lactam antibiotics like penicillin and amoxicillin can't reach the bacteria hiding inside the cells. So those are the ones that survive and keep causing all the problems. And we're making the infection harder to treat. The second mechanism is something known as biofilms. When you wake up in the morning and you rub your tongue along your teeth and it's kind of slimy, that's biofilms. Bacteria creates biofilms. Think of it like a protective shield that antibiotics has trouble penetrating. They're also surviving inside immune cells that are supposed to kill them. The bacteria have learned to hijack our own defense system. And the third mechanism is the growth phase. Penicillin works best on bacteria that are rapidly growing and dividing. But during chronic infection, when resources are limited and the immune system is suppressing bacterial growth, the bacteria slow down. They go into survival mode, and the antibiotics become less effective. So this is really why your child can be on round after round after round of antibiotics, and the infection persists. It's not about the antibiotic being weak. It's about the bacteria being smart and the immune system being too exhausted to do its part. But here's where things get really concerning. And this is something that most doctors don't talk about because, frankly, most don't know. That long-term antibiotic use doesn't just fail to clear the infection, it actually weakens your child's immune system. Let me share with you what the research shows. Studies have found that antibiotics impair the respiratory activity in immune cells, specifically macrophages, which are like the Pac-Man of your immune system. They're supposed to gobble up bacteria. But when exposed to antibiotics, these cells become less able to engulf and kill bacteria. Think about that. We're giving antibiotics to kill bacteria, but those same antibiotics are making the immune cells less effective at doing their job. And you guys, it gets worse. Research shows that early and prolonged antibiotic use can actually prevent your immune system from developing memory. That means your body doesn't learn to fight the infection on its own. You clear the infection with antibiotics, but your child becomes fully susceptible to reinfection because their immune system never learned how to fight it. There's also the gut microbiome issue. Every round of antibiotics wipes out good bacteria along with the bad. And 80% of your immune system lives in your gut. So we're destroying the foundation of immune health while trying to fight an infection. One study found adverse effects in 41 to 52% of patients on long-term antibiotic therapy. The most common issue? Gastrointestinal disturbances and disruption of the gut microbiome. Again, this is a paradox. The treatment becomes part of the problem. We're giving antibiotics to help the immune system clear strep, but those antibiotics are suppressing the very immune function that we need. And for kids who've been on antibiotics for months or even years, we've created a situation where the immune system literally cannot function properly anymore. Now, let me paint you the complete picture of what's happening in your child's body, because this is where everything really starts to click into place. Your child gets exposed to strep. In a healthy child with a strong immune system, they'd fight it off in a week or two. Maybe they'd need 1 round of antibiotics. Done. Check the box. But your child, like my child, doesn't have a healthy immune system. They have an immune system that's already being attacked by tons of different triggers. Some examples include mycotoxins from mold exposure, inflammatory responses to foods that they are eating every day that they shouldn't be, candida overgrowth in their gut, heavy metals disrupting cellular function, environmental toxins, nutritional deficiencies, genetic SNPs. Their immune system is like a fire department trying to fight 5 fires at once with half the firefighters and broken equipment. Then strep comes along, and that's fire number 6. You've tried to put out 5 fires, and now you have fire number 6. So what do? We go to our doctor, we get a prescription for antibiotics, and yes, antibiotics can kill strep, but here's what we're missing. The immune system has to partner with the antibiotics to clear the infection. Let me repeat that. The immune system has to partner with antibiotics to clear the infection. The antibiotics kill some of the bacteria, but the immune system has to clean up the dead bacteria, find the bacteria hiding in cells, prevent reinfection, build immune memory, maintain the response long enough to completely clear it, and if the immune system is exhausted from fighting all of these other battles, it can't do its job. But we don't stop there. We keep going back and getting more antibiotics, round after round after round, and every round of antibiotics destroys more good gut bacteria, allows more candida to grow, weakens the gut barrier further, suppresses immune cell function, prevents the immune system from learning to fight the infection. We have created a vicious cycle. Strep infection, antibiotics, gut damage, candida overgrowth, weakened immunity, can't clear the strep, more antibiotics, more gut damage, weaker immunity, still can't clear the strep. See where I'm going with this? We've created a monster. Meanwhile, the PANDAS triggers, the mold, the food sensitivities, the heavy metals, the environmental toxins are still there, untouched, still overwhelming the immune system. This is why your child flares every time you stop antibiotics. It's not that they need to be on antibiotics forever. It's that you never address the underlying reasons their immune system couldn't clear the infection in the first place. And the strep is not the only problem. It might not even be the main problem. The strep is the final straw in an already broken immune system. And until we fix the immune system, until we remove those PANDAS triggers, no amount of antibiotics will give you lasting healing. Again, this is a paradox. We're so focused on killing the strep that we're ignoring everything that's preventing the body from clearing it. And in the process, we're just making the immune dysfunction worse. So let's talk about what's actually keeping your child sick. I call these the hidden immune drains. And there are several big ones that nobody's testing at. Nobody's looking deeper. Nobody's giving you more information about what's going on inside your child's body. So let's talk about mycotoxins. Mycotoxins are poisons produced by mold, and research shows that they cause something called immune dysregulation. And studies show us that kids with tics and Tourette's have dysregulated immune systems. This is where the immune system becomes both overactive and underactive at the same time. It's like having a car with the gas pedal and the brake pressed simultaneously. The system is fighting itself. And here's what mycotoxins do to the body. They damage the gut lining, creating leaky gut. They cross the blood-brain barrier and directly cause neural inflammation. They trigger mitochondrial dysfunction, and your cells can't make energy. They create massive oxidative stress, think rusty bucket inside your body, and they cause both immunosuppression and autoimmunity. And studies show that mold exposure in children with PANS and PANDAS leads to heightened neuroinflammation, which escalates neuropsychiatric symptoms. Mycotoxins can elevate pro-inflammatory cytokines in the brain, disrupt neurotransmitter function, and compromise the blood-brain barrier. And about 40% of children with PANS and PANDAS have elevated ANA levels. That's anti-nuclear antibodies, which confirms their immune system is mounting an autoimmune attack on their own tissue, and mycotoxins can be a major trigger for this. We had a client, we will call him Jake, who had been on antibiotics for 18 months, severe PANDAS, OCD, tics, rage episodes, and that they were terrifying the whole family. Nothing was working. His parents were desperate. So we finally tested him for mycotoxins, which were off the charts, and every single toxin we tested came back elevated. They found mold in his school, in the air conditioning system. They found it in his home, behind a wall in his bedroom that had water damage, and no one knew about it. This kid was breathing mycotoxins 24/7. So once we were able to address the mold exposure, which was one of his triggers, he did have multiple, but the mold was pretty significant. We were able to support his detoxification with binders, glutathione. We removed mycotoxins from his body. He was able to come off antibiotics with his prescribing physician within 3 months. His symptoms resolved, and that was 2 years ago. He's still doing great. The mold was keeping his immune system in a state of chronic activation. The inflammation in his brain wasn't just from strep, it was from mycotoxins, and no amount of antibiotics could fix that. So here's the reality. If your child is being exposed to mold, whether at home, school, or even in the car with water damage, their immune system cannot heal, period. You have to find it and remove it. And here's what really makes me angry is most doctors never test for this, never even consider it, and they just keep prescribing more antibiotics. Now, I'm not talking about food when we talk about this next drain. We are talking about food sensitivities, not allergies. Those immediate life-threatening reactions are allergies. And I'm talking about food sensitivities. This is a delayed immune reaction that creates chronic low-grade inflammation every single day. When you eat a food that your immune system reacts to, here's what happens. Your immune system releases inflammatory cytokines. These cytokines damage the tight junctions in your gut, the gut lining. Those tight junctions are supposed to keep undigested food particles, toxins, and bacteria inside your gut where they belong. But when they break down, we develop leaky gut. Those particles escape into the bloodstream, and your immune system sees these particles and freaks out. It sends antibodies to attack them. But here's the problem. Those food particles look similar to your own tissues, and this is what we call molecular mimicry. So when your immune system makes antibodies against gluten, for example, it can also make antibodies against brain tissue. The protein structures are similar enough that your immune system gets confused and starts attacking your own cells. This is particularly true with gluten and dairy. These proteins can trigger antibodies that cross-react with neuronal tissue in the basal ganglia, the exact part of the brain affected in PANS, PANDAS, tic disorders, and Tourette's. So every time your child eats toast for breakfast, pasta for lunch, pizza for dinner, if they have gluten sensitivity, you're triggering an immune response that may attack their brain. And you're wondering, why aren't the antibiotics working? Well, prime example. Common food triggers could be part of the problem. Gluten, dairy, eggs, soy, corn, peanuts. If your child is eating these foods and they're triggering immune reactions, you could give antibiotics forever and never clear the infection because the immune system is in a constant state of inflammation, fighting foods instead of fighting pathogens. And nobody's tested for this, did they? They just keep prescribing antibiotics, right? You are on round after round. So here's the cruel irony. All those rounds of antibiotics, they're feeding the problem. Every time you take antibiotics, you wipe out good bacteria. And when good bacteria are gone, opportunistic organisms like candida yeast can take over. Candida damages the intestinal lining, creating what we call leaky gut. Toxins, undigested food particles, and microbes escape into the bloodstream. Your immune system has to respond to all of this. It is in a constant state of alert. Plus, candida produces its own toxins that are directly toxic to the brain, like acetaldehyde and candida toxin. These toxins cause brain fog, mood swings, anxiety, irritability, and cognitive dysfunction. Sound familiar? That's because these are PANS symptoms. So you're giving antibiotics to treat PANS, but you're creating candida overgrowth that's making the PANS worse, and the immune system is so busy dealing with the candida and its toxins that you can't clear the strep. Research shows that candida overgrowth is associated with multiple autoimmune diseases. It damages the gut lining, allows endotoxins into the bloodstream, and triggers systemic inflammation that can manifest as neuropsychiatric symptoms. Studies have found that people with candida overgrowth have difficulty concentrating, poor memory, brain fog, anxiety, and even depression, all because yeast coats the intestinal lining and suppresses the ability to make neurotransmitters like serotonin. So you're not just fighting the strep, you're also fighting a yeast infection that's producing brain-damaging toxins, and every round of antibiotics is making it worse. Drain number 4, heavy metals. Heavy metals like mercury, lead, cadmium, arsenic are everywhere. In our water, our food, our air, dental fillings, and environment, and research shows they wreak havoc on the immune system. They cause both immune suppression and overactivation. They increase susceptibility to persistent infections, and they cause neuroinflammation. Studies show that heavy metals can compromise the blood-brain barrier, allowing for more toxins and immune cells into the brain. This creates persistent neural inflammation, exactly what we see in PANS and PANDAS. Heavy metals damage mitochondria, the powerhouse of your cell, and your immune cells need enormous amounts of energy to function. When mitochondria are damaged by heavy metals, immune function crashes. And research has directly linked heavy metal exposure to increased rates of chronic infections because the immune system simply cannot mount an effective defense. One study found that heavy metals reduce the number and function of neutrophils, macrophages, and natural killer cells, B cells, and T cells. They impair every single part of your immune system. They also cause oxidative stress, free radical damage, that further impairs cellular function and creates more inflammation. So imagine your child has mycotoxin exposure from mold, food sensitivity triggering autoimmunity, candida overgrowth producing neurotoxins, and heavy metal toxicity damaging their mitochondria and suppressing their immune cells. Their immune system is drowning. It's fighting 5 battles at once and losing all of them. And we're giving them antibiotics and wondering why the strep won't clear. And these are just a few examples. Because of what we do at the Tick Disorder Institute Regenerating Health, we are looking at the individuality of every single client we work with. So this is just one example of what is impacting this child's PANS symptoms. We see different variations on a regular basis. So what is the solution? What do we do? How do we actually help these kids who are drowning, right? Their immune system cannot keep up. Here is where we stop guessing and start knowing, because that's the problem with the conventional approach. It's all guessing for the most part. Let's try this antibiotic. Let's try this dose. Let's see what happens. That's not medicine. It's throwing darts blindfolded. So at the Tick Disorder Institute, we don't guess. We test. We don't throw spaghetti at the wall to see We don't throw spaghetti at the wall to see what sticks. We test. We measure, we identify the specific burdens affecting each individual child, because you cannot treat what you don't measure. We cannot make recommendations if we don't have data points and information to guide us on our journey. And here's what I've learned after working with hundreds of families. Every child's picture is different. One child might have massive mycotoxin exposure and moderate food sensitivities. Another might have severe heavy metals, environmental toxins, and candida, but no mold. And another might have it all. It's important that you know your child's specific immune burdens, not what worked for someone else's child, not what the protocol says. What is specifically happening in your child's body? Because when you know what you're dealing with, the recommendations become precision instead of guesswork. So at the Tick Disorder Institute, we run comprehensive functional testing and genomics to identify every immune burden affecting your child. And here's what we look at. We look at food sensitivities. We measure immune reactions to food causing chronic inflammation in your child's body. We look at genetics. We look at genes that affect detoxification, methylation, immune function to understand your child's specific genetic vulnerabilities. We look at stool pathogens. We identify candida overgrowth, bacterial imbalances, parasites, and gut inflammation driving immune dysfunction. We look at mycotoxins. We test urine to see if mold exposure is poisoning your child's symptoms and overwhelming their immune response. We look at organic acids. These show us mitochondrial function, neurotransmitter metabolism, and whether yeast or bacteria are producing toxic byproducts. We look at environmental toxins. We want to measure exposure to chemicals and pollutants that disrupt immune and neurological function. We look at heavy metals. We check for mercury, lead, cadmium, arsenic, and aluminum that suppress immunity and damage the brain. We dig into micronutrients, assessing vitamin and mineral status because deficiencies directly impair your child's ability to fight infection. We look at Lyme and co-infections. We screen for tick-borne illnesses that trigger or complicate PANDAS symptoms. This is comprehensive testing. This is how we stop guessing. And once we have all of that data back, we don't just hand you a stack of lab results and send you on your way. Have a nice day, ma'am. No, we take all of this information and we use it as part of our foundational connection method. We connect the dots between what's showing on your child's test results and what's happening in their diet, their lifestyle, and their environment. We are looking at a complete picture. What are they eating every single day that's triggering inflammation? What's in their home or school and environment that's poisoning them? What's happening in their gut that's preventing nutrient absorption? What genetic vulnerabilities do they have that make them susceptible? And what's depleting their energy at the cellular level? So when we connect all of these dots, it gives us answers, real answers, not guesses. And more importantly, it gives us a roadmap, a specific targeted plan to get your child back on track. Again, we're not throwing spaghetti at the wall to see what sticks. We're using data to create precision interventions based on your child's unique biochemistry. We look at over 1,000 different biomarkers. And that's the difference between what we do at the Tick Disorder Institute and the conventional approach. Conventional medicine says strep equals antibiotics, done. We say, why can't this child clear strep? What's burdening their immune system? Let's find it, remove it, and restore function. And when we work this way, when we test comprehensively and create a targeted plan based on your child's specific burdens, kids get better. Not with more antibiotics and not with years of medication. They get better because we've removed the obstacles preventing their immune system from doing what it was designed to do. Now, I want to be completely clear about something. This is not something you can DIY. This is not something you can take to your pediatrician and expect them to understand or implement. This requires expertise in functional medicine, integrative approaches, environmental approaches, and a deep understanding of immune dysfunction in PANS and PANDAS. It requires knowing which tests to run, how to interpret the results, how to prioritize the interventions, and how to create a comprehensive plan that addresses the whole system, not just one piece. At the Tick Disorder Institute, this is what we do. This is our magic. This is our specialty. We've worked with hundreds of families around the world dealing with PANS, PANDAS, tick disorders, OCD, and anxiety. We give you access to the tools, testing, resources, and education that you need in order to start reversing your child's neurological symptoms naturally. We interpret the data, we create the individualized plan, and we guide you through every single step of the implementation. So, if your child's been on multiple rounds of antibiotics and isn't getting better, or they can't get off antibiotics without flaring, you need this level of assessment. You need someone who understands that PANS is not just about strep, it's about immune system dysfunction from multiple triggers. And you need a team who knows how to identify those triggers and systematically remove them so your child can finally get better. And that's what we do here. And we would love to help your family. And I need to be brutally honest right now. If you're dealing with this, I know you are exhausted. You've spent thousands, maybe tens of thousands of dollars. You've seen specialist after specialist. You've done everything they told you to do, and your child is still suffering. I know because that was me. You've been told antibiotics are your answer. You've been told your child just needs more time. You've been told to try a different antibiotic. You've been told it's psychiatric and to increase psych meds. What you haven't been told is that the conventional approach to PANS and PANDAS is incomplete. It's not wrong. Treating infection is important when infection is present, but it's grossly insufficient. The medical system has failed these kids. Not because doctors are bad people, but because they're trapped in a paradigm that says infection equals antibiotic, problem solved. Except the problem isn't solved because nobody asked why your child can't clear the infection in the first place. I've seen parents after parents spending $15,000 on IVIG. I see them flying across the country to see specialists. I see them trying every single psychiatric medication, and their kids are still sick. Meanwhile, no one has tested for mycotoxins, done proper elimination diets, checked for candida, screened for heavy metals, assessed for environmental toxins, looked at genomics, or actually assessed immune function. These are foundational issues. These determine whether the immune system can do its job or not. And here's what really makes me angry. These tests exist. These recommendations and solutions work, but they're not part of a standard protocol. Standard pediatricians don't know about them, and most PANDAS specialists don't test for them. The guidelines just don't include them. But that doesn't mean they're not important. It means we have a massive blind spot in how we are approaching this condition. If your child, like mine, has been on multiple rounds of antibiotics and isn't getting better, you cannot keep doing the same thing and expect different results. It's insanity, right? You have to advocate. You have to ask for testing. Work with someone who can guide you on this journey. Work with someone who can look at the complexities of immune dysfunction. This isn't about blame. This is not about making you feel like you did something wrong. You did everything you were told to do. I know I did. This is about giving you new information so that you can make different choices. Your child can get better, but not by just adding more antibiotics. They can get better when we address the whole system, when we remove all of the immune burdens and rebuild their foundation. That's when real lasting change happens. So if you're watching this and thinking, oh my God, this is my child. This is our story. Here's what I want you to do. I want you to look at these 4 steps. Have a conversation with your prescribing physician about antibiotics and stopping the antibiotic cycle. If your child has been on multiple rounds of antibiotics without improvement, and they can't stop without relapsing, it's time to try a different approach. So don't just accept this is how it is. Don't keep doing the same things and expecting different results. If the antibiotics are not working, work with your physician to stop the cycle and figure out why. Get a comprehensive assessment. Book a consultation with our team at the Tick Disorder Institute. We will review your child's history, their symptoms, and current plan. We'll determine which testing is appropriate for your child's specific situation. So you can find us at regenerating.health and just click the link for an initial consult. We offer a free initial consult to everybody in our private Facebook group and everybody who is a follower on our YouTube channel. So we highly recommend that you book a call. It is a no pressure call, but we are going to talk to you about what your child's current situation is and what we can possibly do to help. Join our community. Join our community. You are not alone. I do this because I am a mom just like you. We have been down this road. We have resources, support, and educational materials for families dealing with PANS, PANDAS, tics, OCD, and anxiety. So make sure you subscribe to this YouTube channel. You can find us on Facebook at Tick Disorder Secrets, a natural approach. And you can also hit us up at our website, regenerating.health, where you can book that initial consultation call. Follow us on Instagram, Facebook, where we share tips, stories, and the latest research. Listen, I know you're exhausted. I know that you've tried everything, and I know that you are desperate for answers. The families I told you about at the beginning of this video, the ones on 7 rounds of antibiotics, the ones on 2 years of antibiotics, they're now clients with us at the Tick Disorder Institute, and we're working to get them better. Not because we're doing anything magical, because we aren't, but because we're finally addressing the root issues of why their immune system couldn't function in the first place. Your child can be next, and your child can get better, but not by continuing down the same path that's already failing. You need a different approach. You need comprehensive testing. You need someone who understands that PANS, PANDAS are complex, multifactorial conditions that require addressing the whole system. And that's what we do here at the Tick Disorder Institute. Here's my challenge to you. Stop accepting good enough. Stop accepting that your child might have to be on an antibiotic forever to manage symptoms indefinitely. Reach out. Let's figure out what's really going on with your child specifically so we can create a roadmap to get your child back, because you deserve answers and your child deserves to get their life back. Remember what I said at the beginning, PANDAS is triggered by strep, but it's not about strep. It's about immune system dysfunction and multiple triggers. When we address all of these triggers, not just the strep, not just with antibiotics, we see kids recover. We see families get their lives back. Your child can be the next one. I will see you guys in the next video.